Okay, modifier 62, two surgeons. So this would be when two surgeons are needed for a procedure in the OR. Then modifier 62 would be added if they're both doing the same procedure. Modifier 73 and 74, discontinued outpatient procedure prior to anesthesia, and 74 is after anesthesia. So let's say the patient presents to the OR for an appendectomy. Prior to anesthesia administration, the patient maybe has high blood pressure or something's going on that they have to cancel that procedure. The coder is going to code the procedure as if it existed with a modifier 73. Now, if they had administered anesthesia and then they decided to cancel the procedure, same thing. Coder would code that procedure as if it happened with modifier 74. Here's a repeat procedure by the same physician, or repeat procedure by another physician, return to the operating room for a related procedure during the post-op period, 79 for an unrelated procedure or service by the same physician during the post-op period. Assistant surgeon, modifier 91 will be used a lot for laboratory tests when there's multiple laboratory tests. So kind of like modifier 51, which I'm going to go back one, I think. Modifier 51 for multiple procedures that are used, or modifier 59 to show that they're distinct and we can bill them separately. Modifier 91 kind of acts in the same way for just lab tests. So common modifiers for anesthesia. Here's some of those common modifiers that you'll see for anesthesia. So here's those level 2 modifiers that all are with alpha. I believe you do have more detail of those in your textbook as well. And we'll kind of see how all these modifiers are put together as we get to coding CPT in each of these sections. And then here's just some more level 2 modifiers that are commonly used. And here's just a few examples. So let's say there's they did a 29881 bilaterally. So we're going to code 29881 with a 50 modifier. Here's an office visit, and they had a procedure on the same day, so we would append that 25 modifier to the office visit. Here is where there's two surgeons of different specialties that are doing the same procedure. They're each going to code the CPT code with a 62 modifier, so they both get credit and reimbursement for that. So here's real quick modifier 59. The Center for Medicare and Medicaid Services has established 4 new HCPCS modifiers to define subsets of modifier 59. It's more broadly used and an applied modifier because by definition that modifier 59 has been used for those distinct procedure services. And it's really interesting because they believe that a more precise coding options along with increased education and selective editing is needed to reduce the errors associated with overpayments related to the use of modifier 59. So you can see that this is a heavy target, heavy area. So here is what they're looking at. XE for separate encounter, a service that is distinct because it occurred during a separate encounter. XS, a separate structure. XP, separate practitioner. So it's performed by a different practitioner. XU is unusual, non-overlapping service. So this is the use of a service that is distinct because it does not overlap unusual components of the main service. So although CMS will continue to recognize modifier 59, but notes that CPT instructions state that modifier 59 should be used when more appropriate descriptive modifiers available. And here is a link that you can go check out more about these